Okay.
So if this is the clear front part of his eye, his cornea, the wound was actually, and it was hidden by all of that fibrin and blood clot that had kind of spewed through there. But the laceration was essentially from like here, kind of all the way down there. Had more of an angle than that actually is, but it was quite an extensive laceration, and the majority of it was full thickness. So it was a big wound.
Yeah.
Thankfully, I didn't see any obvious lens damage in surgery. He does have some cataracts, but he's a Boston Terrier that's 10 years old. I would be shocked if he didn't have cataracts.
Right.
So, and he has those in both eyes. So I don't think this lens got hit. I couldn't see 100% of it, so I can't say for sure. So that is something we're going to have to keep monitoring going forward, because sometimes if the lens is damaged, we can't control the inflammation that develops after that type of injury, and oftentimes they need cataract surgery to try to deal with it. Again, I don't think that happened, but we're just going to keep an eye out for it. So what we did, and his iris kept trying to fall through this, so we had to keep essentially stuffing it back in, and now he has a bunch of suture kind of just primarily holding this together. Now the good news of this is very close to the limbus, or the edge of the eye, and that's where all the blood supply is.
Oh,
so
good.
as long as we control infection and make sure he's not, going crazy, keeping him quiet, rested, and everything like this has a very good chance of healing relatively quickly, meaning a couple of weeks. The cornea heals slowly overall because it has no blood supply to it, so we need the blood supply to grow into it. So if he had this wound in the dead center of his eye, we would have had to fix it and then probably put a graft over it because of how long it would take for that to heal. So if you're going to have a bad corneal laceration, it's not in a bad spot to get a corneal laceration. So that's in his favor. I know we talked before surgery about the fact that his pressures were kind of high normal, which is something we would not expect with a hole in the eye. We would expect the pressures to be low. So there is a chance that he was starting to develop secondary glaucoma already. After surgery, we took the pressure about an hour after he woke up, and he was around 40. So that is high at that point. So we started him on anti-glaucoma medications. And they've been low normal since, which is good. My hope is that this is just a transient thing because of the injury, because of the surgery,
stress,
because of the inflammation and everything going on. And once we get this wound healed and the inflammation on the inside of the eye quieted down, that will be able to taper him off of medications, and it won't be a problem for him indefinitely. He is a Boston Terrier. They are a breed who get glaucoma as a problem potentially anyway, so there is a chance that this is something that is a forever thing.
What is the definition of glaucoma again?
It's just high pressure within the eye. So anything over 25 is considered elevated. He was at 40 an hour after surgery. Now that could just be he's still waking up from
stress
surgery
and
the stress of the surgery, and that's our hope. And with the inflammation calming down, hopefully we'll be able to get him off that medication. But it is something we have to monitor also going forward. Last big thing that we have to keep in mind going forward is that this number one was from a dog wound, so it's going to be dirty, whether it was tooth, whether it was paw. So that does give him the risk of what's called endophthalmitis developing, or infection within the eye. So he was given that 2-week injection by your vet yesterday. We're going to send him home on another antibiotic, kind of go as broad spectrum as we can, as well as the topical antibiotics for him to be on. And we're going to have to monitor that inflammation inside the eye going forward. The uveitis, or inflammation he has inside of his eye right now, is expected. He had a hole in his eye. There should be inflammation inside of the eye, but we want to see that it's getting better. If it's not getting better and that inflammation is persisting, that further elevates our risk for things like secondary glaucoma development, because it causes scarring inside of the eye when it's not controlled. And if he starts to develop endophthalmitis, it'll kind of mimic that, in that it's an uncontrollable inflammation. So that's why this is such a long, kind of slow process. We did the best thing we could for him by primarily fixing it. I don't think, once we got in there and saw it, I don't think this would have healed well without surgical intervention. I think we would have been talking about removal of the eye if we tried to go that route. So I think we absolutely gave this eye the best chance. Now it's just going to take time. He's going to,
It's up to him after this.
Yes, it's up to him, keeping him quiet and diligence with medications and rechecks. So kind of at-home care, and we have everything written down for you guys, and the discharge is here, so we can just go over them.